So in this form of centering that we're going to do right now, it will take us to a deeper level of centering, and we will then continue onto a self-healing technique based on being very centered. So this is something which you should be doing or consider doing not during your practice hours, but perhaps in the morning or after you've finished work. So first of all, I would like you to just be sitting comfortably in a chair, preferably with your back not touching the chair, and then just gently close your eyes as we're going to go through a journey through your body. Don't do this with your mind as being that of an osteopath, but just an ordinary person just becoming conscious of their body. I'd like you to take your attention to your feet and get a sense of your feet through your shoes to touching the floor, a sense of the floor connected through the building to the soil of the planet, and then thousands of miles or kilometers through to the centre of the earth, which is a ginormous magnet. And get a sense of that grounding, that connection to what we call Mother Earth. Then bring your awareness back to your feet once more and get a sense, if you're wearing shoes, if one foot feels slightly larger or smaller compared to the shoes, comparing with the other side. Does one foot feel warmer or cooler than the other? Is one foot turned more in or more turned out than the other? Then bring your awareness up to your ankle joints and notice if one ankle is more flexed or extended or internally or externally rotated than the other. Or do they feel the same? Now bring your awareness up into your lower legs. Get a sense of your calf muscles and your muscles on the front of your lower leg, and muscles on the lateral aspect. Do both legs feel the same? Do the muscles feel differently, more on one side, more tone than the other? Does one feel warmer than the other? Then bring your awareness up to your knee joints. Is one knee more flexed than the other? Is one more comfortable than the other? Then move your awareness up into your thighs. And get a sense of the muscle tone in your thighs, both the front and the back of your thigh, lateral aspect or the inner medial aspect. Is there a difference between your two thighs? Does one feel more comfortable than the other? Do they both feel the same temperature? Now bring your awareness up into your hip joints and your pelvis. Does one hip feel more flexed or extended? Does one of them feel more internally or externally rotated than the other? Do both hips feel just as comfortable, or is one more comfortable than the other? Your awareness be with the pelvic organ sitting in your pelvis. The rectum, anus, the bladder, and with women, the uterus and ovaries. How do they feel? Are they comfortable? Be aware of the sacrum at the back of the pelvis. Do the joints between the sacrum and the pelvis, sacroiliac joints, feel comfortable? Are they similar both sides? If your body wants to spontaneously move its position to make it more comfortable, just let it happen. But do not intellectualize how you should move. Then let your awareness move up into your lumbar spine. And feel any differences between the upper, middle, and lower aspects of your lumbar spine. Is there a difference between the left and right sides of the spine? Where does the lumbar spine feel most comfortable? Let your awareness move to the abdominal area in front of the lumbar spine, with your digestive organs, the liver, the kidneys, and the adrenal glands. How are they feeling? Are some aspects more comfortable than others? Then let your awareness come up into the chest area. the two lungs and your breathing. How does that feel? Is your breathing comfortable and effortless, or is there some tension? Is there a difference in the comfort levels of the upper and the lower ribs? Is there a difference between the left and the right lung? Is your heart feeling comfortable? Now let's move our attention to our shoulder girdle. Sense of the scapulae, the shoulder blades. A sense of your clavicles, your collarbones. A sense of your shoulder joints and the upper limbs hanging off those shoulder joints. How does that shoulder girdle feel? Does it feel more comfortable on the left or right hand sides? Now get a sense of that continuity from the shoulder joints right the way down to your fingertips on both sides. Which arm feels more comfortable? Which forearm feels more comfortable? Which wrist and hand feels more comfortable? If you have a dominant right side, the way you use your arm and your hand, there's a possibility that the muscles are more tense on that side. But that doesn't always apply. So which is more comfortable for you? Then bring your awareness up to your neck and get a sense of the upper neck, the middle and the lower neck. Do all three regions feel the same, or does one part of your neck feel more comfortable than the other areas? Is there a difference on the left and right hand sides, or between the front and the back of your neck? How is your neck feeling? Now bring your awareness up into the head, to the back of the head, the occiput area. This is where we have the cerebellum, the organ of balance of our brain, controlling our postural muscles, and of course the visual centres for processing the information from our eyes. How does that area feel? Now take our awareness to the very top of our head, our vertex, the highest point of who we are. How does that feel? Does it feel comfortable? Bring your awareness down over your frontal bone, your forehead, and see how that feels. Does it feel comfortable, or is there some tension there? Does it feel more comfortable on one side compared to the other? Now bring your awareness round to the area around your ears, sides of the head. How does it feel in that area? Is one side more comfortable than the other one? Now get a sense of the brain inside the skull. Processing all the information from your whole body, creating our thoughts, creating our intuition, creating our analysis. Does that feel comfortable? All our sensory input going into the brain to give us information about the outside world. Is it handling that comfortably? Now bring our awareness to our eyes. Do both eyes feel the same? Is one more comfortable than the other? Or are they both comfortable? Or do they both have a similar level of discomfort? Bring your awareness down over your nose, your middle face, your sinuses. How does that feel? Is it more comfortable on the left or the right side of that middle part of your face? And now bring your awareness down to your mouth and your lower jaw, your mandible. How does that feel? Does it feel similar on the left and right hand sides? Is it similar for the lower and the upper jaw? Does your tongue feel comfortable? So now we've taken that journey through the whole body. And I'd like you to ask yourself a specific question. Where in my body do I feel the most comfortable? Where in my body do I feel the most comfortable? And it could be anywhere. It could be your toes, your pelvis, one of the organs in your abdomen or the chest, head, neck, shoulders, arms. It could be anywhere. Where do I feel most comfortable? Because your body knows that part which is most comfortable, even if your intellect doesn't know. So just ask that question, where do I feel most comfortable? And just be calm and settled and let the body inform you the area where that may be. And it may tell you as a word coming into your mind, it may tell you as a vision of that part of your body coming to your awareness. It may just be some feeling of where it is. Don't need to know how you seem to know, but you do. Just take your time and let your body give you some clue, some indication of where you feel most comfortable in your body. And it can be anywhere. It does not necessarily mean that it's in the midline of your body. We've all had accidents, falls, injuries, which may make the most comfortable place away from that midline. Where do I feel most comfortable? When you get a sense that your body's telling you or indicating, giving a vision or a word comes into your mind of where that place may be, just take your awareness, your consciousness to that part of your body. The reason that place is the most comfortable is because the physiology is working most efficiently there. The potency within your body is higher there. The circulation is good there. The removal of toxins is good there. The nutrition is good there. All these differing factors are what's making that area the most comfortable at this moment in time. So just let your awareness, your consciousness, just gently go to that place. And as you do so your consciousness is exposed to where your body is functioning the very, very best. Allowing your consciousness to become really comfortable and to expand. And just enjoy this feeling that comes from taking your consciousness, your awareness, to the part of your body which is most comfortable at this moment in time. On another occasion, you may find a different part of your body is the most comfortable, but just go to the place where your body is indicating is most comfortable right now. And you'll find that your awareness settles down into a deeper level of centering, a deeper level of stillness. And now we're going to use this quality of being deeply centered to do some self-healing. So what I would like you to do, staying with your awareness at the place where you feel most comfortable, and ask your body a question. Which part of my body needs to be healed next? Which part of my body needs to be healed next? The body knows the priority in which different areas or different aspects of the physiology need to be improved and healed. This may be different from what our conscious mind is desiring. If we have a pain in the back or the shoulders or the head or wherever, you want that bit to feel better straight away. But the body, acknowledging that region needs help, may decide that, for example, it wants to improve the circulation so that we can get a better blood flow to that area, removal of more waste products, or it may decide we need to improve the digestive system so we can get better nutriment to go to that area to help that healing once we've got better nutriment absorbed into the body. So that's why we ask the body the question, which part of the body needs to be healed next? Because it knows which is at the top of the priority list that needs helping. It may be the area where you have pain or discomfort, or it may be another area that needs to be improved and healed first. That's why we ask the question without any ego or selfish desire. Where does the body want to be healed next? And again, it can give you like a vision of a part of the body, or it may be a word that comes to your awareness of where that place is. Where does my body want to be healed next? And then, when you've got a sense of where the body is indicated needs to be healed next, I want you to keep your awareness where it's located, where your body feels most comfortable, and create a sense of connection between where you have your awareness, the part of your body that's most comfortable, and make a connection to that area where the body is indicated that it wants to be healed next. You could create a sense of a chain link between the two areas, or you might think of something like an extendable dog lead. You may think of it as an internet connection or Wi-Fi connection. It doesn't matter how you visualize it, but just create that connection between the part that the body's indicated that it needs to heal next and that part of your body which is most comfortable, where you're keeping your awareness. The place which is most comfortable, where you're keeping your awareness, is a level of high potency, high vitality. And the part which the body wants to be healed next will be a part that has a lower vitality, low potency, which is why it needs it to be helped and healed. You're making that connection enables that self-healing to take place. Because the body knows what to do when it's got a greater potency and vitality. So you're just making a connection between the part that the body wants to be healed next and that area which is the most comfortable, and allowing the potency, the vitality, to be transported via that connection to the part that wants to be healed next. And then just stay with your awareness where it feels most comfortable in your body, and just observe the area that is wanting to be healed. And you may feel a sense of change occurring in that area. Obviously, depending on the nature of the problem and the severity of the problem, this will require a number of repeated returning to the exercise. And when you get a sense that that area that wanted to be helped has settled down to hopefully a slightly more comfortable state, then slowly open your eyes. Now do remember that if you repeat this exercise, going through that internal journey to find where you feel most comfortable, it may be a different part of your body which next time is the place where you're most comfortable. After a meal, after some fall or injury, after some mental stress or tension, after enjoying yourself, doing different things, different activities, different sports, different hobbies, differing parts of your body will show up as a place where it's most comfortable. So never have a pre-expectation of where you're going to be most comfortable. It could be anywhere in your body on each and every time you do this exercise. It does not have to be where it was last time. And when you come to ask your body which is the part that wants to be healed next, it may give you a totally different area to the previous time, or it may say, I'd like to go back to what we did before. I want to continue that healing to that part. Again, we have no expectation or pre-expectation of which part of your body is top of the list that needs some self-healing. So I would recommend that you repeat this exercise when you've got half an hour to spare,